Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about the common mistakes new medical coders make. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. I've been getting lots of requests for these videos lately. Hey Blue, I'm just about to start and I want to know what I should do to avoid making some common mistakes. What are some of the common mistakes that new medical coders can make? All right, so let us begin. All right, the first one is not researching your clinic or whatever facility that you're at, the setting that you're coding for, whether it's inpatient or outpatient, and whatever specialty it is, whether it's orthopedics, podiatry, that kind of thing. So if they're assigning you to, let's just say, the gastro clinic, then you're going to want to make sure that you start looking at all of the procedures and everything that particular clinic does, so that way you can have some familiarity with it already. You sort of know what to expect, and you're getting familiar with your CPT book. If you're coding in the outpatient side, you're getting familiar with that section of the book so that you know what procedures fall in that section. The thing that I will say about that is there's so much to it, which brings me to my other point. Sometimes you will get what is called a cheat sheet. And some people will say, well, here's the cheat sheet. These are all of the codes that we normally use. These are some of the more common procedure codes we use. These are some of the common diagnosis codes. I personally do not care for cheat sheets. And the reason that I don't care for them is because I don't know who made it, number one. Because it could be given to me by a coder, but I don't know if it was that coder who made it or if it was somebody else who gave it to that coder and passed it on, right? So that's the reason that I don't like to do that, because I sort of like just to start fresh and look at the record and look at the documentation. Because, and you may think, well, if the codes are already there, it's easier if you have this cheat sheet and it'll tell you. It can give you a ballpark, it can give you an idea, but the thing that you have to know is you have to look at that record and you have to make sure that you're reading it so that you understand what is actually happening. Because sometimes, which brings me to the other thing, providers will select their own procedure codes. Sometimes they'll select their own diagnosis codes. And some coders, especially the new ones, will take this for granted and push them on through. Well, the doctor selected this. That is what they want. I'm going to go ahead and give it to them. No, you have to make sure that you're reading the documentation and read it thoroughly. Look and ask questions of what's happening if you don't quite understand. Because a lot of times when these providers are selecting their own codes, they're selecting things that either somebody else has told them, maybe a colleague. It's not always a coder that has told them, hey, these are your codes that you're doing here in this particular procedure. And they're just sort of looking through this on their own. And a lot of times you'll have providers who will select a lot of procedures because they think, this is a procedure I did, this is a procedure I did, when it's actually a combination in that particular procedure. Like a lot of things will fall in together, and sometimes one procedure can cover multiple other procedures because it's already included as an inherent part of that procedure. So that's why I say that making sure that you read thoroughly and not follow these cheat sheets, not follow the pre-selected diagnosis or the pre-selected procedure codes, is going to go a long way into helping you to get better and get sharper, because not trusting those codes is the number one thing you got to do, because you don't know. And when you are pushing codes through, you're putting your name on that stuff. You can't do that. You know, your accuracy rides on it, your name rides on it. And I will tell you this, medical coding is such a small community that there's literally 5 degrees of separation. I can literally meet somebody tomorrow and just at a conversation, they will know somebody that knows somebody that knows somebody that I know. So you got to be really careful, because reputations do get around, especially when you're a medical coder. You want to get a reputation for being a sharp, very detailed, high caliber medical coder. That's what you want. And it starts with being thorough yourself. reading through the documentation and double verifying. If you're looking at procedure codes that are already there, look and make sure that it's either documented and covered, or if it's not, take it out. Or if it needs clarification or query, then you do that. So that's the thing. When you're doing queries, make sure you understand what you're reading, because doing the query is the end of the line. You have to make sure that, number one, you understand what is happening in that procedure. Number two, you got to understand the disease process, because if it is part of the disease process and then you query, that provider is going to get very irritated if that is part of that and they have to explain that to you if you're not going to them beforehand. Because if you're going to them beforehand and saying, can you please help me to understand what's happening here with this disease process or with this procedure? And a lot of times, like usually 9 times out of 10, they will be like, okay, and they'll explain it because they like to help. Providers and other ancillaries, they're happy most times to help. Sometimes they get very short-tempered. It just depends if you catch them on an off day. But for the most part, they like being a part of that sharing process. At least when you're starting to build relationships with them, you should notice that. Which brings me to my other thing. Another common mistake that new medical coders make is not putting in the effort to have a relationship with your provider. Now, yes, they're very scary sometimes, and some get very gruff, but most times they're pretty open. You just have to be willing to show that you are open as well, because they will not reach out to you. You have to be the one to take the reins and reach out to them and be like, hi, I'm your new coder, and just introduce yourself. Take that time. And if you say, well, Blue, I'm really shy, I get really nervous, you have to work on that. That is something that comes with the territory. You have to be able to communicate with these alpha personalities. And as a byproduct of your time as a medical coder, you will in turn become alpha yourself, but you have to put yourself in that position to be able to speak up for yourself and speak up for your work and to be able to defend your providers, because part of what you're doing when you're establishing these relationships and getting to know these providers is you're understanding how they are so that their documentation makes more sense. Every provider documents differently, and every single provider has a different way of saying things. When you start to know and understand what's going on with them, like as far as like how they speak and how they document things, then it's going to be a lot easier for you to start learning how to interpret what they're saying, right? And not only that, you'll be able to find out if there's any holes just by listening to them. And taking that time to build those relationships is critical, because if you have to do queries, if you have to ask them for clarification on a procedure, or you have to ask them to give you like some other information that is missing from there, they're going to at least know that you're not trying to tell them what to do, that you are their coder and that you're looking out for them. That's the key. Because a lot of times what happens with new coders is they will run into an instance where they need to send a query. And they'll do what I call a cold query. Cold query is where it'll just pop up in their inbox for this provider. You have a query from so-and-so, the new coder. And they're going to be like, well, who in the is this? Because they're going to be like, who are you? Why are you questioning me? How dare you question me? Why are you just sending me this? This is why I tell you guys, establish your relationships right away. Now, if in your facility you have somebody who does all of the provider education, that is something different. Obviously, you want to follow the protocol at your facility. But a lot of times, there's not that. And the coder is responsible for it, which I personally prefer. Because when you are the sole person that is speaking to them, there is less confusion. Because if you have one person speaking to them, another person, and a supervisor, and then they get emails from the coding people, this person said this person said that, oh no. You want to talk about providers shutting down real fast? that's a surefire way for them to shut down quickly. So this is why, even for me, I insist for my providers that nobody but me speaks to them. And I have been very firm about that. And for good reason, because again, you have to establish that trust. You have to be able to build that trust with your provider. And in order to do that, you have to be firm about it. And when you're making sure that you understand what's happening, you're going to become more specialized for that specialty. And the more specialized you are for that specialty, the more detailed the codes are going to come out, the more detailed you're going to get, because all of these things roll into one. So it is about being open with your communication, studying and learning more about your specialty, because relying on somebody else's codes or relying on a cheat sheet is only going to hurt you, because that's not helping you to grow. We have the opportunity every single day as medical coders to grow with our knowledge, with just everything that we do, just because of what we do. When you're reading all day, when you're having to figure this stuff out, when you're having to look stuff up, oh yeah, it plays a huge part into growing your knowledge base. And when you stop that by using the cheat sheets or pushing through those codes, you never know what you may have missed out on. So you don't want to be doing those things. Don't cheat yourself. Yes, there's going to be times when those cheat sheets may be helpful for you in the beginning to sort of get you going in the right direction, but make sure, don't rely on them, but make sure, because sometimes people get tunnel vision and they think these are the only codes I can use, when in actuality, maybe the provider was documenting additional things that you could have picked up. You see? So that's why I say it's just better to use those as maybe a guide, but not something that you rely on, right? So that is the first part. The other one is not asking for help from your fellow coders when you need it. Sometimes you are able to ask like a supervisor or maybe like a lead coder. If you see them trying to reach out and say, hey, do you need help? Because I've done that before, where I have seen a coder struggling and I know that they need help. And I said, well, do you need a hand? Can I help you in some way? And they're like, no, I got it. I want to get it. Okay. But then you see them sit there and spin their wheels. Well, as they're sitting there spinning their wheels, that clock is ticking. And when you start overthinking, which is something that a lot of new medical coders do because they don't want to make mistakes, and I get it. I was there. But if somebody's reaching out a hand to say, hey, let me explain this to you, let them. Don't be so stubborn as to think I can get it all on my own. I don't want anybody to think I'm stupid. It's not about that. I will still ask questions to this day. I'm very particular about who I ask questions to, because I don't just ask anybody. I ask one person, and she is my very good friend because I trust that she knows. And she always tells me, Blue, I don't know everything. But the thing that she does know is how to research and look up how to find the answer. Because sometimes I have a hard time like phrasing the question, right? I'll be like, and I'll sort of explain it to her, and she's like, okay. And so then she'll start to work backwards, and she'll start to say, okay, well, look for this and look at this. And then I know a website, and so she'll tell me. And so it's just like, okay. And so she'll help me, but she's not one of those ones that will just give you the answer. She's one of those ones that will help you understand why, which is what I love. I'm very grateful for her, but only when I get stuck. I always try to find somebody that's as smart as me or smarter than me. So to me, that's the way that I always roll. And if you feel like you need somebody that is going to, be up there as far as like their knowledge base and things, yes, there's people who have lots of credentials on their name, but it still depends on what their experience has been. You can't always just look at somebody's credentials and think, oh, well, they have a degree, so they must know. Or they have all of these credentials, so they must know. It depends. Some people just get the credentials to have that alphabet on their name and they haven't had the experience. You know, I know this because I've had to train people who are degree holders. And so like I said, I won't be a credential snob because it's on the caliber of the coder. And just by listening to them speak is what helps me to know if this person is going to have legitimate resources or have legitimate reasons as to what they're looking at and how they're looking at it. So when they're explaining it, then I'll be like, okay, this person knows what they're doing. So it's not all about, well, I'm going to believe them because they've had 5 years of experience. You don't know if that 5 years of experience has been only in one clinic and were they doing evaluation and management in that clinic? Because not every clinic has evaluation and management. And before you get excited, oh, there's a clinic without it. Well, there's a couple of ways that you can do no evaluation and management, but you're stunting your own growth. So that is one thing I will say. Don't do that. You know, don't get excited when you hear about something like that because you're just going to end up stunting your growth. You don't want that at all. So make sure you know who you're asking, and if somebody's offering you help, go ahead and take it. Listen to them, hear them out. If they're offering it to you, just hear them out and don't shut them down right away. That was probably one of the most irritating things that I encountered in the beginning when I would see coders struggle and then they would do that. And then it was just like, because our supervisor at the time, wonderful, wonderful lady, she knew how to be a leader. And when I would offer my help, I would be like, you know, do you need hand? You know, well, because I know about this clinic. No, I got it. And they would get like really super mad. I'm like, I'm just lending a hand. I'm not trying to make it like I know more than you. I'm just trying to lend a hand. And our supervisor would get really upset because at us as a group, because she would say, why aren't you guys helping each other? You should be helping each other. And so it's just like, I tried, you know? And so that's the thing I always want to tell new people is if somebody is trying to reach out a hand to you, just hear them out. You know, it doesn't necessarily mean that you have to follow everything that they say, but just hear them out. And if you go and ask somebody questions, make sure, please, to take notes. That is another thing that is slightly irritating, is when I get somebody who will ask me a question and they won't take notes. Then they'll come back to me 5 minutes later asking the same question. Now, I will let things go like that. When it comes to answering questions, I can be a slow burn. As far as like, okay, well, I'll answer it again. But after a while, it's just like, nope, you know, you're going to have to learn and you're going to have to start writing stuff down. So if you're going to somebody, ask and write things down and do not apologize. That's another thing that I will say that brand new medical coders do is apologize too much. Don't apologize. You're still learning. Everybody knows that you're learning. So make sure that when you are asking a question, get straight to the point. Don't put it with all this, I'm sorry, I have this other question and I'm so confused. Okay, they already know that you're confused and that you're coming to them for a question. Just ask the question, because a lot of times these coders, they have stuff to do too. They want to help you, but you got to get to the point very quickly. So that is one of the things that I will say that new medical coders do quite often. So don't be afraid. Whatever you do, don't be afraid. Don't be afraid to ask questions. Do not be afraid to research first before you start asking questions. Because when you start asking questions without doing your research, you're going to get coders that will tell you, do your research. And you don't want that. You want to show that you're doing your research firsthand, first, before you go and you start asking. And by research, I mean looking stuff up on Google if you have to. What is a diagnosis code for? Or can you code this with this? And a lot of times these different websites will come up, different discussion board threads will come up. Again, you have to verify what is being said in that discussion board, but sometimes it will lead you to a path that'd be like, oh, I didn't even think of that. Or I didn't think of wording it this way, and now I can figure it out. But do the legwork, guys. You got to do the legwork. Use your Merck manual. I always recommend the Merck manual. The Merck manual is amazing because it tells you about the disease process, the symptoms, the treatment options, and all the things that go into it. But it is a very valuable resource, and it is a reliable resource that you can use to defend yourself if you need to in an audit. There's also the coding clinics, and they're available if you have an encoder. They're usually available there. It just depends on the system itself. You can use your medical dictionary. You can use the Coder Desk reference for procedures, Coder Desk reference for diagnoses, the coding companion, all of these very amazing tools to help medical coders. And then, of course, there's the books themselves that will give you some sort of guidance. So that is the biggest thing, is when you are brand new, ask questions, but make sure you've done your research first. And make sure that when you're asking that question to like another coder, you could say, I was doing my research, I found this. Can you help me to understand this because it doesn't make sense to me? That will get you a lot farther than, I don't get this. Can you just tell me the answer? The first option will give you a lot more advancement into like, okay, this is because of this and this and this. And you may find that the coder may not know. So it depends, again, on what their background is and how much experience do they have. So always stay humble, especially when you get something correct and somebody who has more experience than you didn't get it correct. Stay humble, because there's nothing worse than somebody who gloats. You know, well, I got it right. You know what I'm saying? It's a great feeling to get something right. But to have that kind of attitude in the beginning is really bad. Anytime, you know, you never want to get like that. You know, you want to stay humble and know that you relied on the books and you relied on your resources to help you, and that your training is just a boost to get you that knowledge, more knowledge every single time. So that's my advice. But if you are new and you're out there and it's your first job, stay into your work, because that's what's really going to help you, especially in the beginning, to learn. Please stay off your phone. That is another mistake I see a lot of new coders make, and I see other veteran coders making that mistake too. They'll be on the phone all day long, and they'll still say with a straight face that they don't have enough time to get their quotas done. Guys, gotta be reasonable. You gotta stay reading, and you gotta stay plugged into what you're doing, okay? Because your phone will be there later on, right? So that's it. That's my advice for today. But it is such an exciting field. I say that all the time, but it really is. You know, when you think about all the things that you're learning, and it's just, and then it's a puzzle. Every single encounter is like a puzzle. And then when you start working with surgeries and you're having to read all these op notes and things like that, it's amazing what you learn. And just by reading it, and then if it's not making sense, watching a surgery video on it on YouTube. That's the amazing thing about YouTube, is that there's so much information out there, and it's just readily available. You just have to plug it in. So anyway, I'm gonna go ahead and wrap this one up. I hope you guys enjoyed this, and if you haven't had a chance to subscribe yet, I hope you'll hit that subscribe button, like this, share this if it helped you, because it may help somebody else. Have a great weekend, and I will see y'all on Monday. If you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider, or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye!